Program do not necessarily reflect or represent those of the owners, management, or advertisers of Pacific Telestations Inc. This message has been brought to you by the stations of KUAM.
You're watching Buzz with Jess Lujan.
Good evening, Guam. I'm Jess Lujan. Exciting show tonight. I have the ladies, the regulators are on here tonight, public health regulators, that is. We have Cynthia Duvall, who's the planner with the Department of Public Health and Social Services. Rosanna Robigo, who's the public health, environmental health administrator. You got a big name badge. Good evening, ladies. How you doing this evening?
Oh, thank you for having us.
Well,
yeah,
no,
doing well.
You know, thank you for accepting my invitation to come on tonight. There are quite a few changes in the issuance of health certificates that will be implemented real soon. So those of you in the food industry or anybody that's required to get health certificates, listen tonight. What are the changes, ladies?
Wow. I think one of the biggest changes we have is that with the implementation of these new regulations, we're going to be requiring everyone who gets a health certificate to take a training workshop.
Okay.
Currently, only people who work in the food service industry need to take it. But we're expanding that to cover all of the categories of health certificates that we issue. Anything from cosmetology, tattoo, institutional. We'll be issuing new health certificates for the areas of hotel and swimming pool. And again, we'll be having training workshops that go along with those as well.
Okay.
That's probably the biggest one.
The biggest. Now, when you say you're needing, they're needing to go through this like a workshop or something
Yes.
like that, right? Yeah. Now, I know the legislature, the current legislature just passed the public law, what is it? Gosh, I forget what it is, the public law number. But anyway, they just passed it, and the governor signed it into law May 1st, right?
I think it was passed May 1st and signed May 7th.
May 7th,
Yeah.
okay. That being said, so how long after the signage of this that there's usually 30, 60, 90 days before it goes into effect?
Well, in this case, they allowed us 365 days.
Oh,
we
a
have
year
a couple of,
okay,
to get everything implemented.
Okay.
We've got a couple things that could slow down the implementation. One of them is the completion of our new laboratory, which is where we intend to hold the bulk of the training workshops.
Okay.
And we're looking at possibly moving into that one in September. We need to finish the curriculum for the workshops that we're now taking on. We have a pretty good set of slides and training done for food. We've been doing the food, and GCC has been doing the food workshop for years. We're developing, nearly finished developing, I think, the cosmetology workshop. But we need to start in on ones for swimming pool, hotel, and the other areas that will be
now,
offered.
when you're talking about these workshops that are going to happen, I mean, and I know you said you have, I guess, a lab where people are going to attend this. Now, if I'm in the food service, would I again be attending a seminar with other food service providers, or are we combined with, I guess, cosmeticians and
we will have individual workshops. If you're coming there to get a health certificate that deals with food, you'll be going to the food safety workshop. If you're coming for cosmetology, you'll probably have a smaller group, but you'll be coming only for people to learn more about sanitation and safety in cosmetology.
So these are specific to the trades that they're involved with,
yes,
right?
They are. Yeah, because a lot of them have got different requirements. If you're there for food service, you probably aren't interested in about the sanitation that would be involved in taking care of a pool, for example, or a hotel room. So we focus on the sanitation and safety risks for those particular jobs. Yeah.
Roseanne, go ahead. Yeah.
One of the other significant changes to the health certificate rules and regulations is the requirement for food service manager certification courses that will be required for all individuals who will be working in a food establishment. And that's going to be, like right now, anytime you have 5 or more employees, you have to have a certified manager present at the facility. Well, now it's going to expand that regardless of the number of employees within that existing facility, you will have to have a food service certified manager.
Every shift. So not just one for the facility, but for every shift. If you have 2 or 3 shifts during your operation, you need to have the certified manager.
Now, say a mom and pop store. I mean, mom and pop stores, they sell a lot of closed food in containers, but you also have a lot of food that is brought in from other vendors who are just wrapped in saran wrap and things of that nature. Now, do they fall under, same category as maybe a food server as well? Because they're serving that. I mean, They have that kind of food as
Yes,
well?
even
Yeah,
if you're
yeah.
serving, working with packaged foods,
Packaged
like you
foods,
do in
yeah,
a
yeah.
retail store, yes,
okay.
you already, your workers need to take the food safety
Oh, okay,
workshop.
okay,
So they
okay.
will also fall under needing to have a manager's a person with a certificate of management certification.
Oh,
Yeah,
okay.
for every shift there.
Oh, so
Yeah.
every shift will have the manager there will have a certified.
Correct.
Oh, wow. Okay. So, I mean, and what was the purposes? I mean, did we see? I mean, was there a flaw or was just I guess the new things that were happening and all these foodborne stuff that were happening that the rules and regs were updated? What was that?
The rules and regs for the Guam Food Code took effect in November of 2015. One of the requirements for that one is a demonstration of knowledge. So when our staff would come in there and do an inspection, the manager, person in charge at the shift, was required to show a demonstration of knowledge of food safety. One of the easiest ways to do that is to have a certificate of management certification. If you have one of that, then you've met that requirement. So this makes it easy for every manager and every facility to be able to meet that one new requirement of the new food code.
Now, let me ask this. We talk about these convenience stores that are all around, whether they're gas stations or what have you. Now, you have their items that they sell that you buy off the shelves, but you have also items that private vendors will come in, whether it's empanada or these sushi rolls, whatever it may be. Now, okay, so you require the place to show, I mean, the employees back there to have health certificates and the place have their sanitation, permits and all that. But how do I, as a consumer, know that this particular vendor that I'm buying their sushi roll from or empanada or whatever it may be, right, that was not necessarily, that was, again, a independent contractor that brought it in to sell at that place. How do I know that independent contractor there has their required permit and health certificate as well to be selling those products?
Well, that's an interesting question because you rarely see the sanitary permit number on the label. But manufacturers of those things are required to have both a permit and a health certificate in order to produce those. And you're right, there's no easy way to do it. Each of the vendors could require them to show it before they displayed their food in their store, but it's not something that's mandatory under the food code or anything else.
Yeah, no,
So,
and the reason why I'm asking this, because some of the times you see some either the sandwich preparations are refrigerated, and maybe the same or same vendor that would service this one fast food entity versus another. This fast food entity will have it in a refrigerated place, whereas another just out in the open. So I see there's not a consistent thing on where they're placed and all that. So as a consumer, what should bring red flags to me as a consumer for these products?
well, I'd say food. You got this?
Yeah.
You got it.
As a consumer, consumer beware. I mean, that's what we always say. Consumers should beware of visiting these retail stores and seeing these types of foods being displayed just on the shelf at room temperature. If there are, we have another saying, keep hot foods hot, cold foods cold. If you see sandwiches, then this retail store has a responsibility for, number one, to ensure that the food they purchase within their store are from an approved source, which means that if they're buying sandwiches, empanadas, sushis, that they're buying it from a reputable facility that has a sanitary permit, and that the individuals who are transporting the food have health certificates, and more importantly, they should be checking the temperature of those food items as it comes into their retail store. Consumers should definitely be aware if they find these potentially hazardous foods just out for display and sale right on the shelf.
Well, I mean,
That's a red flag.
We see a lot of that. I mean, I see quite a few that are in compliance, the bigger outlets, the bigger store in compliance with that. But I see the smaller outlets that have it like right there by the cashier or somewhere else around there, in a cutout carton and stuff like that, and pick out it. And I'm going, I don't think that's right. I'm hungry for that, but I don't think I'm going to pick that up today.
Right. It's not only not right, it's not safe in most cases. So.
And our division has been very proactive, we like to think. I mean, we've sent out numerous press releases in the past informing all retailers about the need, the requirement to keep these foods under proper temperature. whether it's hot, in a warmer, or whether it's in a chiller. We've sent those letters out. We've actually gone back and found a lot of repeat violators, numerous violators. Because like you said, I mean, we're not blind to what's happening, but we're so limited with the staff that we have.
Now, let me ask you this. Now, say I was a vendor and I was providing my sushi rolls, okay? Now, I transported it the way I'm supposed to transport it and all that. Now I've given it to you, okay? You're the mom and pop, okay?
Right.
And so I'm giving it to you. You should know that you should put these places in either a cool container that's supposed to be cold and the hot and what's supposed to be warm. Now, if there is a problem here, now who is the citation with? Because I've transferred it to you, now the citation is for
With
you?
the retailer.
Yes.
The
Okay.
retailer.
Retailer,
Yeah.
okay.
Right.
Now, would it be incumbent again upon the vendor themselves to say, Roseanne and Cynthia, look, this requires, refrigeration. You have to provide this, okay? Now, is it incumbent of me to say that, to tell you again, or are you supposed to know this? Are we supposed to mutually know this and know the handoff is, you know where you're going with the handoff?
Right.
I mean, how is that done? Because there's really inconsistencies. I mean, even this morning I saw that, and I made sure I looked at that because I knew you were coming on tonight. And I went to two places, and identical, same provider of this thing. One was refrigerated, the other wasn't. And
Right.
I would assume the one that was refrigerated was abiding by the code.
Yes.
And the one that wasn't. Right?
Well, I would think if there were special handling
Yeah,
instructions with that, then yes, they
Sure,
certainly should
yeah.
inform the retailer. But as Rosanna said, once it's in the retailer's hands, it's their responsibility to
yeah,
comply with the code.
Yeah.
And more importantly, because they're all working in the food service or food industry, they've all went through the proper training. And that's one of the reasons why we really thought carefully about wanting to impose certified manager certifications in all the food industry because number one, we don't have enough staff to go out and police these retailers. Number two, we've really gone out of our way to educate and cite these repeat violators. I mean, some of them just still continue to violate this provision.
Yeah, no.
I mean, up to this day.
I mean, I'm looking at some of the things that are being sold, and I think it's great. I mean, when I was growing up, I mean, we knew who pickled the daigou and all that, right?
Yeah.
But and you didn't see. I mean, for a while there, you didn't see too much, but now you're starting to see some of these things, and they're being provided by other folks as well. So I'm, hey, that kind of looks kind of good, Who did that? Oh, we don't know. Somebody came in and they sold it, or and I'm going. Not necessarily the same vendor that would provide these sandwiches and all that, but someone that would provide the pickle daigo, the pickle mangoes and all that. Now, they would have to have the requirements as well. Now, what does that require? I know they're pickled. I don't know if that has, that I guess, kills the bacteria and all that, or whatever it's supposed to be in there. If that's enough, that just being in vinegar and all that, and not have to be refrigerated, How do I know? How do I know what's good for me?
That's very
That's a
true.
good question.
Yeah, and we're assuming that if they're manufacturing, that they're also getting theirs from an approved source, what goes into the things that they're manufacturing. So it all goes back down to, we do make some assumptions
Yeah.
that they're following the rules and they're getting it from an approved source.
We hope so, right? Yeah.
Yes, we
Anyway,
do.
we're going to take
Okay.
a quick break. We're going to pay some bills right now.